drinking out of my Babe Cave cup today because I'm feeling good as hell. Hey everyone, welcome back to my channel. I'm Effie. I want to talk about the 5 facts about rheumatoid arthritis. So today, many of you may or may not know, is Rheumatoid Disease Awareness Day. The organization that created it is the Rheumatoid Patient Foundation. I'm going to link their website below, roomforus.org. Fact number 1, rheumatoid arthritis affects 1.5 billion Americans. This doesn't include worldwide. Most of the people diagnosed with rheumatoid arthritis are women, and they are 3 times more likely than men to be diagnosed with the condition. The reason why more women are diagnosed than men is 2 reasons they have possibly found as causes. 1, the immune system tends to be stronger and more reactive in women, and hormones are a risk for development of RA and flares especially. That's why you see many women who are diagnosed with rheumatoid arthritis after they give birth to a child or children, and especially in young adults, even babies. I had a rheumatologist recently that I saw when I was on the search for one. She said that because she treats both pediatric and adults with juvenile arthritis and RA, so in her practice she's found that there are babies and toddlers diagnosed, and that's a huge time when the immune system is really reactive, especially in young girls. And then there's a huge break, and they don't see any kids or young adults being diagnosed from the baby toddler range up until teenagers. So sometimes in 5th grade as well, but there's a huge gap. So those are the 2 age bracket ranges, like teenager, like 15, 16, 17, 18, where your hormones are really working overdrive. And that's true for many young girls. So that's the 2 things behind why they think women are diagnosed more than men. This brings me to the next fact, number 2, the disease isn't understood well. They have many known triggers and causes, but there is no cure in terms of what can stop the disease fully. We have many medications and alternative medicine practices and everything out there that can help slow the progression of the disease and sometimes stop the disease landing a person into remission. Remission, I want to mention, is not necessarily a cure. When a patient goes into remission, it basically means their disease activity has stopped. So then they are allowed to get off their medication and they don't have any symptoms of pain, inflammation. Sometimes though, a patient who goes into remission, they may still experience pain, inflammation, partly due to the fact that they have had damage. That's just not going to go away. And that's why many people get confused as to what a remission is and what is a cure. Many people think that going into remission for them is a cure because then they don't have to take medicine, they don't have to go to the doctor and do all this stuff. And I partly agree with that, yes, but a cure is to basically go back to your normal state of being before you even got sick or diagnosed with any illness. So, the main causes, I'm just going to read this off because I want to make sure I mention all the triggers. So we know DNA and genetics are a huge factor. Thanks, mom and dad, ancestors, whoever you want to thank for that. Environmental toxins, stress, hormones, food allergies and intolerances, gut issues, viral and bacterial infections, to name a few. There's a bunch more listed out there, but these are the main things. They also say cigarette smoke, so if you're smoking cigarettes and diagnosed with rheumatoid arthritis, they will always ask you to smoke and to stop indefinitely, forever, because they have found that that is an environmental toxin that can actually trigger RA, and even if you don't smoke it, being around secondhand smoke is very dangerous just in general overall for your health and for anyone. But when you're around cigarette smoke and you have RA, it's a potential for a trigger and to actually cause flares. So yeah, that's fact number 2. Fact number 3, rheumatoid arthritis is not an old people disease. This is not the type of arthritis that your grandparents get, your parents get from general wear and tear. The difference between general wear and tear arthritis, such as osteoporosis or osteoarthritis, where many times people develop from sports injuries or just using a joint repetitively over time, you may find, like, even if, like, for example, on your phone, if you use your phone too much, many people develop carpal tunnel. or if you cook too much, or you just have a profession where you use a certain joint repeatedly over and over time that joint is going to become stressed if you don't take care to take breaks or use other methods to relax the joint, and you can have, eventually you can have arthritis in that joint. Same thing with sports injuries. Many people who've had, sprains, they broke a bone, they may find later on in life that that joint is acting up. It's not an old people disease. Many young people get rheumatoid arthritis, especially what they call juvenile arthritis. That brings me to fact number 4, which I just mentioned. It's an autoimmune disease. You need to take medication for it because your immune system, which normally defends the body from a foreign substance, is not understanding that your joints is not the enemy. So there's cellular mimicry going on, whatever you want to call it. Your surrounding joints, muscles, tissues, ligaments are impacted by the disease because your body thinks that that is an invader, and there is a switch that has turned on and it's not supposed to be on, and that's when medication and other therapies are given to patients in order to control that and eventually halt that process from progressing. And that's when people go into remission, like I had mentioned before. It also doesn't just involve the joints. It involves organs sometimes, and even the eyes. So when people think about rheumatoid arthritis, they just think, okay, well, it's just arthritis, it affects the joints, it doesn't impact anything else. That's false. And that's why the Rheumatoid Patient Foundation made this awareness day, because they are trying to change the way we label the disease. So everyone knows that it's rheumatoid arthritis. Many people don't know the way that it can impact someone beyond the physical. So there's an emotional aspect, mental, spiritual, financial, romantic, social, like just there's a bunch of categories in one person's life where it impacts. Usually the symptoms, they come and they go, but then they come back and they persist for days, weeks, months, years at a time. And that's when you know there is a problem. Because with rheumatoid arthritis, there's different subcategories, believe it or not. There's seronegative, seropositive. Don't really have much time to go into that in this video. I will make another video possibly explaining that. And then even for kids with juvenile arthritis, there's different subcategories and subtypes. So not everyone who is diagnosed with a form of autoinflammatory arthritis has even the same one or same symptoms. And that's why they want to change the name to rheumatoid disease, to give an all-encompassing view and bigger picture of what it actually does to a person. So that brings me to my second to last fact. Early detection is key. They say now that within 2 to 6 months, if you are not diagnosed and put on medication or have some sort of treatment plan to control the disease, you are at risk for irreversible joint damage and disability down the line. So there's a statistics that says people who are diagnosed late and put on treatment late are at higher risk that within 10 years you will not be able to work and you will be on disability. Brings me to my last and final fact. Movement is key. Many people think that with arthritis you should not move, and that is completely false. The joints and the muscles and the tendons and ligaments are meant to be moved. Even our ancestors, they were doing all these exercises and workouts, and we are meant as human beings to be active, not sedentary. So when you see people sitting in front of the TV or in front of a computer or texting, like, with their neck hunched over, I'm guilty of all those things. We all have been. That puts you at more risk for disease in general. So when you have already a condition at play, the last thing you want to do is not move. And yeah, you might not feel good one day, and you might be in pain, you might have a flare, but even during flares, you can do some light stretches if you're able to, or just some range of motion exercises that can help. Because a lot of times when you start moving and you work out an area that's hurting you, it will feel better, and you can ice it, heat it, and do all these other things that can help. Obviously, if you're doing a form of a workout or a stretch and you have sharp pain, then you should stop and take it easy a little bit. And that's what they always say. When I go to physical therapy, if they say if something hurts, don't keep pushing through it, because maybe, something is going on that you need to take a step back and address in a different way. Maybe you need to massage out the muscle, or just tape it, or go about another way of doing the workout properly so you don't injure yourself. And in fact, regular physical activities such as walking, swimming, cycling, or anything that preserves the joint mobility, helps maintain muscle strength. And a lot of times with rheumatoid arthritis, you can have like weight loss and muscle loss due to medications or even just the disease itself. Find something that works for you. Contact maybe a sports medicine doctor or physical therapist or a trainer who is well versed in helping people with arthritis, because not everyone really knows how to navigate that. And if you do, that's great. That's my last fact for the day. And there are so many more facts at play, but I feel these were the most important to share today, especially on Rheumatoid Disease Awareness Day. So yeah, please share, like, and subscribe, and pass this along to everyone you know in order to help raise awareness today and beyond.